As an educated meathead, I want to be doing everything I can to recover from each training session. Rapid reboot compression therapy is one of the tools in my tool belt that I not only use in just my office, but myself after every single leg session, and it really makes a difference. Use my promo code Dr. Marvin Says to save money on any of the compression systems. That is definitely Dr. Marv approved.
You're between two dumbbells. I'm your host, Skip Hill, and I'm bringing over 40 years of bodybuilding experience to the table, including over 24 years of online coaching. I'm joined today, as usual, by my co-host, Dr. Marv, aka the Educated Meathead. For every show, we posit a thought about a training exercise or training methodology, and then we deep dive into the minutia. Today, we're going to run the gamut. We got a critical physique assessment. We have a couple videos that we're going to assess form, mechanics, tell you whether your form sucks or whether it's pretty solid. Got questions from the listeners. We got a bunch of stuff today. While you're listening today, or if you need supplements, go to truenutrition.com. Use the link in the closing credits to save 10% on not just Team Skip protein, but every supplement they sell. Not only do I use my Team Skip protein with my clients, but other top prep guys have their clients use my protein because it's that good. Critical physique assessment. I wonder who we have on the chopping. Oh, it's Dr. Marv. I'm going to rip this guy to shreds. I heard he's a nice guy, but I'm not. So I'm going to have a little bit of, oh, wait, it's that Dr. Marv. Oh, my God. Get them pictures. I'm ready. I'm starting with the intercostals. I know you have shitty intercostals.
Yeah. So we thought it would be fair, since Skip was brave enough to put himself on the chalking block, I should probably do the same, right?
Did you say chalking block?
I did.
That's a malaprop. That is a, listeners, viewers, that is a classic malaprop.
There
it is not an eggcorn. I will not get into what the difference is. That's for you guys to figure it out. If you have questions, ask me in the comment section.
Your pedantic, eruditely language is just too great for my pedestrian plebeian mind.
I jump into these viral arguments. I just unloaded on a dude for whomever, and he was sure he was right. And I just finally came back, he had the white flag. And I walked away high-fiving myself. The cats were high-fiving me. It was awesome. Anyway, what do we got?
So I'm on the chopping block.
There you go.
Today. So everybody knows that I'm the educated meathead and I'm the beat up educated meathead. So I'm sure people are sick of listening about it. Well, hopefully that's going to finish, because this Friday I'm getting 5 million stem cells put in my body, i.e. the nectar of the gods, via IV at Longview Regeneration and Wellness here in Texas, that I was referred to by Dusty Hanshaw. I would have said the whole thing is a total scam based on everything, including the price, but Dusty swears by it, and I've talked to their clinical director, their medical staff several times. So I am very excited, because I've been waiting a long time. So the goal is try to get my shoulder to get better. Otherwise, I'm getting surgery this December. I'm done. I've dealt with the shoulder for 5 years.
Why did you think it was a scam?
The website is pretty basic. The phone system's pretty basic, and the price is dramatically cheaper than anywhere else I've talked to.
Okay.
And they're saying it's umbilical cord derived stem cells, which I didn't know we were doing in Texas yet. I thought it was only Utah. So I'm super excited. Like, they said all the right stuff, but I think they're just trying to stay under the radar. I might be blasting them for saying this, but like, if it works, I'm documenting the whole thing. I've done a whole series on my YouTube of all of the stuff I've done leading up to it. So all the mitochondrial support stuff. I'm doing antibiotics right now to clear out. They're called senescent cells, i.e. zombie cells. So cells that are replicating, but they're not doing a function. So I've done all that.
They go by another name too, cancer, I think.
Yeah.
Or at least that's what it sounds like. I don't know.
Yeah, it's starting to, it could. They're not cancerous yet, but that's the they're old, worn out, right? So trying to flush that. You're essentially getting a facelift. So I'm doing all that. I will say though, with the situation I was dealing with all the stress, I've been blown away by all the mitochondrial stuff with the amount of energy and mental clarity I had with only sleeping 5 to
Yeah.
6 hours a night. Like there's something there to it.
Yeah.
But that's not the scope of this show. But we're doing all that. I'm literally bringing my shockwave machine to be shockwaving myself while the IV's going in my other arm. So I'm going to shockwave and laser and blood flow restrict, trying to get the stem cells to go there. So we're trying to get my shoulder to get better and my knee to get better. The elbow should help. The wrist, right? Probably not. But if I could get the shoulder and the knee to where I'm not in pain, like rolling over in bed, apparently for the last 2 years, when I roll over in bed in my sleep, I say, ow. And my wife's been like, with you not training, you haven't said ow when you roll over in the middle of the night. I'm like, oh, nice. Right. So this was a bit of like throwing my hands up. I've got to try stem cells. I've done all the right stuff. I've done prolotherapy, which is a saline injection. I've done PRP. I've done all the peptides, right? So I've slowly worked my way up versus just jumping to the top, right? Because I think a $200 saline injection could be the answer versus a $20,000 stem cell.
Well, and PRP as well. You didn't get any results from the PRP?
No, it
Really?
was a shot in the dark. Yeah. So, which was a bummer. Yeah. And then every peptide you could imagine. I will say education only, the bioregulator Cardilax helped my bum knee a ton. Right. So that was helpful. But if we could get my shoulder primarily and my knee to be where it's not, limiting me in the gym, because on screen right now that you could see the range of motion I was restricted to, right, with my shoulder being torn, and it was pretty brutal. There's times where I could only use one chest press machine in all 3 gyms I could go to. I had to go to the same gym for chest because that's all I could do.
But that's a good point for the listeners and the viewers. Sometimes there are those exercises that if you try to force because, well, I was told that I have to do this, whether it's squatting or something that is written in the, I would say the annals of bodybuilding, but in our Bible, our bodybuilding Bible, if you will.
Yep.
I have to do this because I'm going to either lose size or not grow if I don't do it. Yeah, no. Correct. Go with the exercises that don't hurt and continue to exacerbate the problem.
And I actually got my chest better.
What was that exercise? I already know what I bet I know.
So
it's my favorite one.
So it's just the seated plate loaded press machine. That's it.
Oh, it's not the wide angled hammer, decline hammer.
So as of late, I was able to do that. Yes.
Oh,
was that then that was too much. Even I couldn't even get in the stretch.
Okay.
Then I've been able to do the wide, and then the last 2 times I trained, my shoulder felt so good. I even did light guillotine presses, which is my favorite upper chest builder of all time. But that's such a vulnerable position for the shoulder. But again, I was still pushing training. I was still growing. I couldn't train my shoulders directly more than once or twice a month just because the shoulder pain was so bad, but they're my God's gift, as we could see. So again, if you can only do one movement, you still do that movement.
Oh yeah, no question. Yep. No question at all.
So
we're going with the chest.
Preamble. Yeah. I mean, I think it's pretty apparent, right?
Okay. But let me point this out because this is also a good point, I think, for the listeners and the viewers. Your weakest body part is likely weaker to you. And when I say you, like I'm pointing at you, Dr. Marv, but it's also my weakest body part is my weakest body part to me. Doesn't mean that other people don't see it, but it's almost certainly going to stand out to you more than it is to other people the vast majority of the time. I look at your physique and I'll be honest with you. I don't immediately go to, oh, his chest sucks. You know what I mean? It's not like this glaring weak point. But I think too, as males, we tend to look though at, I mean, even competitive bodybuilders, I think we go arms and chest first. Like that's what stands out the most because it's so masculine and male ego type thing. So I don't think it's a strength, but at the same time, I don't know that it stands out as a glaring weakness. How are we going to bring up this chest. This is what, provided that the modalities that you're using in the stem cell and everything else, work. And I anticipate that they will. I'm sure you do too. You might have your doubts, but let's assume that they work. And from there, I am not going specifically to specific exercises. And I've said this before, I'll say it again. I'm not big on, well, this specific exercise is going to bring up someone's chest, whether it be you, whether it be me, or anybody else.
Okay.
I am of the camp and have been of this camp for a long time. The exercises that you feel, or I feel, or anyone listening feels more and can connect based on their structure. So many things. Whether it be the size of the rib cage, the size of the upper arm, the clavicle width, everything. And it doesn't matter which muscle group we're talking about. Those exercises that you connect with and you feel the most, there's a pretty good, it's very, very likely that those exercises will contribute to progress when it comes to hypertrophy more than the exercises that you struggle to feel. Now, there's exceptions to everything. But I think that's a pretty good rule to go by, which is why when someone comes to me as a client, and sometimes it irritates the shit out of them, they want me to tell them specifically the exercises to do. And I don't like to do that. I like to provide a list basically saying or focusing on area of the pec, or is this more of an isolation move versus so that we can get a sequence that is sensical, but not necessarily specific exercises. Example, I'm an opener guy, but I'm an opener guy in the sense that they don't necessarily need to be to failure. We need to isolate pre-exhaust, which I would recommend for you as well. Isolate, pre-exhaust, get a lot of blood in there, decrease the vulnerability or the risk of injury by making sure that you're warm. Once you get to your, I'll say, heavier or more important exercise, I don't think anybody ever got huge on cable flies versus, compound movements. So when someone may be listening going, well, you told me to go with what feels good, and I get a better pump when I do pec deck flies. That's not what I'm talking about. We still need compound exercises. We still need to focus on progression of weight and intensity. I know a thing or two about training, but I built a reputation in the bodybuilding industry for removing skin. If you have too much skin, call me. Remember, skin is overrated, but not as the primary driver. In my opinion, this is where I differ from a lot of people. Progressive overload, we have this thing in our brain that says, well, we have to have more reps or we have to have more weight. But the increase in time under tension is also can be progressive as well. So we have the intensity factor, which is multifaceted, all that good stuff. I would still have you open with something like that, a pec deck. And here's an example of what I'm talking about when it doesn't matter the exercise. If a pec deck doesn't feel good, sometimes it doesn't feel good to me, but cable flies do. Or machine flies versus a pec deck. Pec decks are, number one, hard to find. I think they're great exercise for me. Okay. And then it comes down to what type of pec deck that is. When you come together and you can't get it any closer than this, and remember, this is an elbow game. It's not hands, it's elbows. If you're not able to get in tighter, like the old body master,
or the vagina.
Yeah, exactly. Weenus and vagina. Very, elbow position. Everything with upper body is elbow position. And using as much of a range of motion as you can that is comfortable and within the limitations of your flexibility and ranges.
I think two somewhat decent dudes did a whole episode about that. I think.
Pretty good one. So it comes down to the type of machine you have. That type of thing too. Anyway, opening with that isolation move, I think is great. Moving on to something, and listen, I don't have any type of magic like, oh, wow, that was really profound what Skip said. A lot of times when you have a weak muscle group, you set the not the parameters, but you set the variables in place, and then you just bore yourself with the consistency. A lot of times when you're progressing, whether it's on a muscle group or just total body, and you're in an off season and you're growing, it's arguably the weakest and most non-detailed check-ins I get from clients, because everything at that point, once you get going, if things are going the way they're supposed to, it's pretty uneventful. You're progressing, but there's nothing there like, oh man, yeah, all of a sudden this, or oh wow, I had a bad work. There's not much to note there. So it's kind of put the variables in place, grind it in the sense that keep it consistent, and then we're going to assess the entire time, but make sure that there's enough time to assess where you're at. So I know we have different, you sometimes will look at it, I think, in longer intervals than me. I'm more of like a 8 to 12 week. I think people can get a pretty good idea of whether what they're doing is effective, and we can see the patterns and assess and go, okay, the trajectory is heading in the right direction. And trajectory, what I mean by that is trajectory is everything, because nothing is linear. It's going to do this all the time. You may come in one week and you don't feel as strong, but that trajectory, as long as it's trending in the right direction, cool. So I'm still going to talk about the exercises, just in the sense that I do like to follow up, and this has a lot to do with the Team Skip training protocol. So is this programming perfect and optimal for everyone? There are a lot of variables in there that can be tweaked, but after training myself for 41 years and I almost say hundreds, but the reality is thousands of clients, directly, but then also indirectly through intense muscle and things like that with my training methodology and concepts for 25 years. But I have seen where this type of protocol, the progression of the volume throughout the blast cycle, really has a big payoff. So if I were in charge of your training, I would have that as well. Building from, it could be building from one working set or two working sets for a couple weeks to 3 to 4. And at the end of the blasts are short, they're only about 6 weeks long before you deload. That volume might be too high for you to handle, but that doesn't mean not to do it. It means pushing that progress or that volume higher than what you can optimally recover from, and then pulling back on the deload and starting with that low volume again, so that you're doing this up, down, almost falling off a cliff as far as volumes, up, down over time to essentially keep recovery optimal. The other thing I would say is I think it's going to be important, not just for you, but anybody in your situation, whether it's a weak back, whether it's weak legs, chest, doesn't matter. Start with the volume lower. You're coming back from a layoff. You haven't trained much for quite a while. So even though you have the layoff and you have it in your brain, if you're feeling good, you're going to want to come back. And especially if you're gaining consistency, the motivation is there. Psychologically, you just want to rip the place apart. That's bad because that's going to challenge you from a recovery standpoint. So you or anyone else, myself included, needs to do the least amount of work to achieve the most out of your training. So keep the volume low as long as you can. I would say not even to jump into the progression of the volume right away. I would keep it very low for the first 6 weeks and just let everything feel good, gain momentum, I want to say allow, but I can't get to it. Allow the strength to start to build on its own without necessarily having to force it. Forcing or really challenging your strength is probably better incorporated 8-10 weeks into your program once everything is feeling, especially coming back from an injury. Come on. Last thing you want to do, you've dealt with these injuries or this injury for so long. The last thing you want to do is get in there and even start having minor aches and pains again. Enjoy that time of feeling good, building up the confidence, because I will tell you this, you may already know this, but even the viewers and the listeners, if you have an injury for any significant length of time, You can try to compartmentalize it, but it's going to be in the back of your brain until you build that time where it doesn't bother you. And that will eventually overpower that feeling of, I might F myself up. It took me over a year, probably more like a year, maybe 15, 16 months when I had the knee problem to finally make myself go, dude, you just don't have the injury anymore. Come on now. So it's hard once your brain is wired or programmed a certain way to not be scared. And fear will always, you got to be smart, but fear will limit us, especially as we get older. I know I've grabbed the 100-pound dumbbells and went, yeah, I could probably press those 120s, but I'm going to stay with those. Whoa, wait a minute. I can press with good mechanics and good form the 120. What am I doing? What am I doing? Good form. Good form. Mechanics are tight. There's no reason to sit there on the hundreds when I'm still trying to grow. So I'm throwing more methodology at you or ideology than I am specific exercises. And that might be a downer to the viewers and the listeners, but this is how training is programmed by some people. It's not that OCD, black and white, here's a spoon, you have to do it exactly like this. And I know you are a rep tempo. Well, we both are. I'm a rep tempo guy, but not to the extreme that you are, where
I take it far.
Yeah. And that's okay. That's not wrong or right. It's just a preference. So I'm not knocking it. I'm saying I don't want nothing to do with it because it's too complicated for my brain.
And a lot of it was finding ways to make things challenging with lighter loads to help the joints. Plus, slow and controlled is going to be easier on an injured joint, right? Because I could have all my stabilizers versus just catching and rebounding.
So, and you're controlling variables. I mean, there's certainly nothing wrong with that. Not at all. I think because I have trained for so long, and if someone saw my training,
they would
my rep tempo and stuff, they'd be like, that's pretty controlled. So I get what you're doing. And maybe there are some people out there who the metronome is a good idea because it forces them to slow down. But I would argue that the metronome could be used to their advantage in situations like that if they need to force themselves to slow down. But it may not be something that they have to continue with for a long period of time. It could just be a couple months. It could be a few months. And that would kind of reprogram the brain to go, okay, this is the type of tempo that I'm looking for. Now I'm used to this. This is my new norm.
Okay.
Now, as far as upper, lower, all that sort of stuff, opening with an isolation move, then a couple, it's usually 2. I call them growth sets, or I'm sorry, 3, but for chest. One of those 3 growth sets, though, does need to be focused more on the upper pec. And the reason I say 1, even if you have a lagging upper chest, I have found, and I have found it with a lot of clients, it's easier to overtrain the upper pec than it is the rest of the. I mean, to the point where I can watch my incline poundages start to regress while my decline and flat are going up or at least remaining stable. So it's kind of an odd thing. Obviously, anterior delts come into play. You have to question whether the anterior delts are actually overtrained. It also comes down to where is that incline? We change the incline, degree based on a myriad of factors. I still think my narrow clavicles play a part in that. How much range of motion do you have for protracting, retracting? Your mechanics, are you retracted like you're supposed to be on an incline, which is even arguably more important than on a flat? I would say throw out, and this is, I'm making a black and white statement here, but it's one of the few times that I make a black and white statement that I feel confident in the fact that even if the small amount of people could benefit from keeping a flat dumbbell press or flat barbell press in their toolbox or in their workout plan, they still would not lose the benefit by dropping it and going with a slight decline. I think the flat angle for the vast majority of people, with the exception of dumbbell flies maybe, but from a pressing standpoint, I just think that 98% of people could drop that flat position for a slight decline and then just go with a slight incline, and they would be golden and cover the entire pec area from a training standpoint and have that workload balanced over the entire pec. Now I could go on because I am quite verbose, but I'm going to stop there and ask you what you think based on what I said versus what you plan, or because there's already
correct.
stuff
So
going on in your head.
I have some questions. Is the frequency? What is the rep range? I'm assuming this is RIR first before failure since it's been so long, or do you want me going to failure right away?
Definitely RIR.
Performance chiropractic and sports medicine in the Houston Bay Area, telemedicine and nutrition coaching all over Texas. And if you're not in Texas, don't worry. You still do consults through the educatedmeathead.com, where you also find workout programs, seminar recordings, and online courses.
Yeah, definitely RIR. Good point, and that's a great question because that does need to be clarified. The RIR and the lower volume, and I always start with volume first because I feel like that's the bar on the equalizer that is one of the more easier to control. With intensity, a lot of us are black and white. We have that point where, especially if we've trained for any length of time, we have that point where we want to go, and not going to that or going past that is not in our comfort zone, I guess. So from a frequency standpoint, I'm still a guy that wants to start at one muscle group, training each muscle group once a week. From there, once you're in and you're able to train to failure and you're starting to progress and you're gaining momentum, then we can tweak the equalizer bar a little bit. If you feel like your recovery is great, and here's the thing too, remember, there's a progression in the volume. So you might think in the first couple weeks, especially coming off a deload, man, I got more in the tank. I could train more frequently. You're not to week 3 and 4 yet, and you're not to week 5 and 6 yet with the increased volume. So there's that. You have to get through a couple blast cycles. I'd say at least 2, maybe 3. And that's going to put you, roughly 20 weeks, 22 weeks. I'm trying to do the math in my head. 22 weeks into this. So I wouldn't play around with the frequency at first. I wouldn't. I would literally just kind of set the equalizer bar and just leave it, and then allow the volume to go up. And then you can adjust the intensity after you feel like, okay, or kind of assess how you're recovering. Am I recovering well? Can I take a little bit more? If you're recovering great, don't get greedy. I say this to everybody, accept that you're progressing well and you're gaining momentum instead of going, I know I can do more. Because it's not about the amount of work we can do. We can always do more work. It's about the amount of work we can recover from. Rep ranges, I would strongly advise you to stay out of the rep ranges below 10, unless it's later in the workout, you're very warm, fatigue is starting to set in, and you have been through a couple blast cycles. Then if you happen to drop down below 10 and it's later in the workout for that muscle group, I don't see that as much or as much of a vulnerability or a risk as I do if you were to come out of the gates, you've done a couple sets for openers, and you jump right into your first growth set exercise, and you're at 8 reps, training to failure. Ooh, that's a ballsy move. It's a hell of a gamble with a $32 million plane, Lieutenant. The older demographic will get that reference.
So I've actually thought about trying your methodology of increasing volume over a training blast. Like when I go back to the gym, I was thinking of whole body 3 days a week for the first few weeks, 1 working set per body part. Just get back in, keep it super simple. I'll be sore as shit. Like I actually did blood flow restriction twice this week for arms, which is the most lifting I've done in officially 2 months. 1 round for tries and buys. I was so sore. Good Lord Almighty. So that'll be interesting. But once start with reps in reserve. I was thinking, 15 reps minimum starting out.
Probably a good call.
And then slowly go from whole body to upper lower, right? Training 3 to 4 days a week only.
Yeah, because you're going to last about 2, like most people do, about 2 weeks on a full body exercise plan.
Correct.
Then we're like, we got to change it again.
Exactly. So get that going, see how the body's doing. Also, I've been told no lifting for 2 weeks, and then you could start going back after 2 weeks, see how it feels. I'll probably feel worse for the first 2 weeks, but all I'm going to be doing is treating patients, cardio for blood and BFR, and that's it. But once I'm back to training, I was thinking of giving what you do a run, because it's been so long for me training, right? I've only trained 7 times in 6 months, it is what it is.
And it's
I'm
going to
be so
come back fast. I
It's,
mean, let's
oh
be
yes,
fair.
it'll be fun. We're going to
Yeah.
document it. Like, it's going to be fun, because I will only be able to fit in my 70s clothes and my 3-piece Italian suit for another couple weeks. So make sure I wear those as much as I can. But then, yeah, I think this would be the time for me to do RIR training, which is normally nails on a chalkboard to me, just because I'm going to be so excited to be back. Plus, it's not putting undue stress. I don't need it from a stimulus standpoint. Like I said, like blood flow restriction arms, I was sore the first time. I did it again yesterday. Today I'm fine. But like that first time, I was like, oh man, it's been a minute since I felt DOMS. This is awesome.
Yeah.
So
yeah.
Doing that. But yeah, I wanted to try what you've talked about multiple times, because it is so different for me. And now's the time to branch out and try stuff like that. So yeah, I'm overall very excited, and we'll just see what the body tells me, because I have not been able to overhead press in 2 years. I miss it. Is it necessary? That's a maybe, but I'm one of those people who's stronger overhead pressing than flat pressing. So ego misses that.
I have never felt that in my life.
Yeah.
Stronger at overhead pressing.
Yeah.
Wow.
Well, remember, shoulders were dominant. My chest has come up a ton, right? So also, we won't go down that rabbit hole. So yeah, now's the time to do RIR stuff. Now's the time to be higher rep ranges, and then just see what the body tells me and see what I'm allowed to do. But it'll be super fun. People have asked we document, so I figure once a month we'll just do 2 to 3 minutes with my update.
That's what I was going to ask, if you were going to update, because I think a lot of people want to know, and they're going to see it, and they're going to ask anyway, because they're going to be like, oh, wait a minute. What's going on? This guy is starting to inflate.
Correct. Yeah, because if the pictures where my physique was where I was earlier this year at my all-time biggest at 247, I've been open about, and I'm below 200 pounds for the first time in almost a decade, right? So that's that after picture. At least I'm somewhat, I'm lean for like beach lean, right? So at least I look decent with my shirt off still, even though to me I'm tiny.
Yeah.
but
we all feel like that even as we get bigger. So there's that too.
Yeah. But I shared with you the last thing, and then we'll probably move on, is it was wild when we were in Austin to get away and celebrate everything that happened. Walking around town, man, I am down 60 pounds, and I felt it walking on the street, walking past people to where people didn't move as far out of the way. And I was like, man, I was never like a mass monster. That'll never be considered that. But 250s with abs, like lightly visible abs that people saw, is bigger than the average person. So there was people moving out in respect, and then just feeling like I could protect my woman. And I was like, ooh, I do not like this. I feel like a ninja at this weight, but I did not like, I just felt like I didn't have as much mass behind me to protect her, heaven forbid, which was a weird thing. That caught me off guard.
That's actually also weird, because my wife, when I go anywhere with her, if there's any problem, they got to deal with her, because that is one bad bitch. The kids growing up, they'd say now, because they're adults, they're like, our friends were intimidated by you, Dad, but not
Mom was
anywhere near as much. They wanted to avoid Mom like the plague.
That's awesome. So I'm really excited. But yeah, I actually plan to do what you've talked about on here as an experiment. So that'll be fun to update, and fingers crossed. And if not, well, at least I tried it. So it's time to get surgery. And
exactly.
We'll do it in December. So one way or another, I should get back to being able to be a real meathead and start training again. And I'm super excited.
Yeah, I think either way, hopefully the stem cells, though, where anytime you can be non-invasive, it's always a better move. But 2026 looks to be your year with a lot of stress behind you. Without being, detailed, but with a lot of stress behind you, and you be able to move on and get past these injuries and back to what is kind of your norm. And that, I think, will be cool. Not that can't happen at the end of 2025. I'm just saying at least 2026. I'm looking forward to that for you.
Yeah, we're laying the groundwork for next year starting now. Yeah.
On that note, let's transition to the assessment, essentially, of the videos. We have a couple videos for form, and we're basically, how should I say, we're going to rip these to shreds. Notice how I decrescendoed. Now that I'm older, I decrescendo when I use the F word. It's there, but you got to really work to hear it.
Yep. Which one do you want to do first? You want to do them in the order we got them, the squat thing first?
Yeah, yeah, that's fine.
Yeah. So it's up on screen right now. I will say kudos for ingenuity. I thought I was creative when I did garage gym workouts. Good Lord Almighty.
Yeah.
My initial knee-jerk reaction was, oh my God, that is so sketch.
Exactly. I was like, and then I even thought too, I'm like, man, the setup time for that. Not that it would be not that it'd be all that laborious, but I mean, you got to get everything in place. You got to I'm just a low maintenance kind of guy. That's why even chains and things like that, I'm like, I don't want to mess with that. We'll leave that to the power lifters.
What I can't figure out, and maybe you can, is that a resistance band he's holding on to, or is that a barbell? Because like, if that's a barbell on J hooks, if he pulls that thing back, he's
done.
Yeah. Like,
he's done for. And I'm sure that he played with it. And you know, here's the thing about training in your home gym. You're going to jimmy rig these things. You're going to play around, at least you should, to try to get some added variety. So I think it's actually, ingenious in the sense that he's trying to think outside the box. He's trying to change angles and everything. I just look at it and go, there's so many things that could go wrong here, but he's got it right. I mean, the video shows the angle is good. Nothing is moving. The block isn't moving. Nope. And I can't tell if the block is braced against something.
Yep. That was my question.
Then you look at the angle and you're like, well, it may not move, but at some point, you know, like does it take triple the amount of weight that he needs to stack on there for it to move? At some point it can move. Yeah. So it's a pretty, it's a gamble.
Like obviously controlled reps, I would assume this is a finisher, right? So, but I'm like, how is he going to step off now as the video ends, right?
I wanted to see how he got on and how he got off.
That is my big question, is how do you get in position?
But the form itself, I mean, let's be fair. It's pretty solid.
Deep. It's super deep. It's super controlled. You could, I mean, it literally looks like he's doing the cue that I like people of pulling yourself down to engage hamstrings, right? Like it's so slow with so much intent. You could feel the legs firing. So kudos to him.
Well, and what's he trying to do? I mean, very clearly, he's trying
to mimic
of
a belt squat and a pendulum in one.
Exactly. He's essentially trying to turn the belt squat into a pendulum. And I'm like, man, that's pretty good. That's pretty and we say that because just for any of the viewers who are not understanding what we're getting at, the angle of pull, that pulley is in front of him. So, and then the angle of the, what, 2x4s, 2x6s? I can't tell, but him making that or inclining those, it's pretty good. It's pretty good. If you don't have a pendulum and you feel confident that block is not going to move, I still say getting on and off of it's got to be a gamble.
That's what I would pay to see.
Yeah.
So Roan Rangers, send us how you start and end the set.
Exactly.
I do now. I will say kudos and thank you for trimming your video, because nothing's worse when a client gives you a training footage and there's 92 seconds of dead space. You're like, dude, it takes 2 seconds to edit it. But I always want to see the final rep, right? Then I get on, you know, one of the few people I still work with one-on-one. I was like, dude, I need to see how the calf set finished. Like, did you actually hit failure, or did you just say the pain was enough? I love the setup and I hate it at the same time. He's just got to be so careful. But it would be getting shearing force off the low back. Right, it's definitely a lengthened position move, like mimicking a pendulum.
I give him props for the for getting outside of the box. Just be very careful. Like, I don't want to tell everybody, hey, go do this.
Well, like I would imagine he's had to mark where his foot has to be on the
Well, we assume
wood
he's
blocks
OCD like the rest.
specifically.
Like you
Correct,
and
because like
me.
that has to be, if one angle's off geometrically,
Yeah.
he's toasted.
Well, and there's a risk too, and I think this is an important point. It's not even about anything slipping or moving at that point. It's that if they're not even
It's
or one's higher,
balancing.
exactly,
Yeah.
then now you have your hips in a pretty bad spot, and everything coming off from your ankle to your through your knee, through your hips, lower back.
Yep.
It's a problem. So hopefully everything is even in there or
Yep.
as close as possible. But I was hoping it was a finisher as well. Now,
Yeah,
a
I
safer
would
finisher
assume.
might be a somersault squat, but I like the fact that if you can safely do this, then you have, I think, more control over an exercise that can provide more benefit because you have a higher or a broader range for resistance. Like as you get stronger, you can continue to get more weight on there. So I don't know. I give him props for getting outside of the box. They do the reps look solid. The depth is great. I just want to assume that everything is as even as possible, like you do. Good deal. Good deal.
Kudos.
Didn't get to rip him apart too much. What's the next one?
So he's got these super heavy 115-pound upright rows.
I can kind of set the, what happened was in the comment section on YouTube, through the course of a conversation or going back and forth, I guess an exchange, back and forth with someone who was posting, they mentioned 115-pound dumbbell upright row. And I thought to myself, oh, I think he means barbell. Because I mean, 115-pound dumbbell upright row is like, holy crap. And in my brain, I'm thinking that it's a double, but that's okay. I mean, one at a time. I alternate them left, right. So, whatever. But I asked him, dumbbell or barbell? And he said dumbbell.
And then he said one arm. And you and I both said, I want to see that.
Exactly. I was at first I was like, he's not even moving this. Like, this is going to be pretty rough. So, but I didn't say that. In fairness, I'm saying it now, so he's hearing me say it now. Man, they were doubting me. So I said, I want to see that and send me a video or something like that. And he did. So when he said it, I thought, okay, well, he's got enough confidence in this that maybe it's not too bad. And I looked at it, assuming right off the bat, it's gotta be crap form. That's before I ever looked at it. I look at it and I can see, and this is my take on it. It's not great mechanics. Let me get that out there. It's not full range of motion. And with an upright, well, let me finish. It's not great mechanics, not a full range of motion, but they were far better than I anticipated they were going to be. So I want to say that. The reason that I say that it's not a full range of motion and how you or how I gauge that is in an upright row, upright dumbbell or barbell row, upright row of any kind for the shoulders, or a side lateral. If the upper arm between the elbow and the shoulder does not come up to parallel or very close, then I consider that, okay, you're you're outside of your wheelhouse as far as where your strength is. You need to lower the weight to be able to get the arm either parallel to the floor or very close to parallel to the floor. Don't watch the dumbbell. Don't watch your wrist or anything else because that doesn't, The elbow needs to get as close as possible or parallel to the floor. And that's not happening. What also, I watched it a few times. I also noticed this too, but it took me a minute to figure it out because I'm like, yeah, it's not there, but he's also, or not, when I say not there, not getting up to that parallel to the floor position. But here's what makes it a little bit worse in that sense. He's leaning as well. So
Mhm.
the lean is already, even if he were going parallel to the floor, that lean says even parallel to the floor isn't exactly parallel to the floor. I mean, it's parallel to the floor, but it's not where the parallel to the floor should be. That makes no sense, but I think the viewers will get what I'm saying when they see or if they notice the lean. Do you see the same thing, right?
Mhm.
Okay. All right. Now, he's also because I did ask him, I'm like, are you training for, strength or hypertrophy? And he said both. If he would have said for strength, I'd have given him maybe another point on that. Hypertrophy, then I want to back off and I want to say that weight needs to be a little bit lighter then, because that range of motion matters so much more and the feel of the exercise.
Mhm.
So I'm looking at that exercise going, he's moving the weight from point A to point B, and he didn't just get 6 reps. I mean, he got quite a few reps. I don't know
Yeah,
what the rep count
way
was.
more than I anticipated.
Yeah, and the intensity is there. I have no
Yep.
issues with the effort component. But I do think, and this is just my best guess, instead of a 115, he could probably pull a 90-95 clean as hell with a more and an upright dumbbell row is not an exercise that I consider a very slow movement like you would with curls or dumbbell press or something like that. There still should be an explosive component coming out of the hole, but there should be that full or better range of motion to where the arm is higher, the elbow is higher, and there you are able to resist on the way down. You're not going to be able to just barely move it, down. That's not going to happen like you would in a curl. But there should just be better control. And I think pulling back from that 115 to that 90-95, and I'm guessing it's in there somewhere. Could be a little more, could be a little less, would provide a better benefit from a development standpoint. It would just add more stress to the targeted muscle, because when you're exploding like that and there is a little bit of body movement, you're involving so many more muscle groups than what you're trying to target, and there's momentum. So I say pull back a little bit, but it was way better than I thought it was going to be.
Johnny and Branch would be proud.
Yeah, no kidding.
That reminds me of their type of training.
Sure.
Right?
And some people would argue, Spike could argue, well, they got big, they got huge, it worked for hypertrophy.
Correct.
I'm not saying it won't work for Spike. Maybe his shoulders are, twice as big as they were before. I don't know what that progression looks like.
Yep.
So I would say this, if you're not progressing from a developmental standpoint from the hypertrophy side of things, then back it off. Back it off, then run that for 3 months and see. And you might notice, oh shit, I got a little bit better shoulder development than I did before by backing off a little bit. And at the same time, the side effect is you're lowering your vulnerability. You're to that shoulder joint, lowering the risk of potential injury.
Yeah, like I was thinking more like accessory work for strongman when I saw this.
I thought the same thing.
Yep.
I thought the
that
same
makes
thing.
sense. Let's do some anatomy breakdown stuff though.
Okay.
Because I think it would help people. So,
and while you're doing that, I will say this. I do think the upright dumbbell row is an underrated. I've said it on many or several shows. It's an underrated, underutilized exercise that I think it's a great exercise.
Yep. So the issue with upright rows is impingement. So from about 60 degrees to 90 degrees of shoulder abduction, which is your arm out to your side doing a lateral raise. 2 structures in particular are at risk of being pinched. One is your supraspinatus, which is part of your rotator cuff. The most common person to have this torn is an elderly female from years and years of this rubbing with a lack of blood supply. So that just shows, right? It's just chronic degeneration. Majority of folks will have a tear of this muscle as they age and not even know. And then another structure in particular, the long head of your bicep, goes under this hook and that gets impinged too. But what's interesting is once this shoulder gets to about 90 degrees, so your arm is parallel to the ground that you're so big on, above that, the risk for impingement goes down. And once your arm is above 120 degrees of abduction, arm out to your side doing a lateral raise, that impingement's almost completely gone, right? So it's that 60 to 90 degrees that has the biggest risk. And the risk is compounded if we have certain structures that aren't strong. And we're going to, since it's been a few podcasts since I've talked about this, we need to talk about two main muscles are doing a motion that is massively important, that motion would train. That's why, to me, I was like, oh, strongman training as an accessory makes perfect sense. So the trap's going to be heavily involved in this motion. So the upper and the lower is going to do upward rotation. So it's taking that hook that I showed and rotating it up, clearing space. The middle trap's going to be doing a lot of shoulder blade retraction, so in and keeping it pressed against the rib cage wall. But then another important muscle I've talked about multiple times, the only other muscle that upwardly rotates your shoulder blade is this called your serratus, right? So that's going to be massively important. And that is so important for shoulder health. When I took a world-renowned international sports chiro's shoulder course, she said strengthening this muscle, the serratus anterior, fixes 80% of chronic shoulder pain complaints. I think 80% is a little high, but it shows the importance of it.
Mm-hmm.
But he's got to have good rotation, and he's got to keep that shoulder blade against his rib cage. If he has something called scapular winging, where it literally, we've all seen that, especially like young kids where they're hanging out at the pool and their shoulder blade is like off their back by like 4 inches. Like that movement with that much shoulder blade winging is incredibly dangerous, and you're asking for nerve entrapment and other injuries. So I would doubt that is the case with him, but just putting it on his radar.
Can I add something real quick?
Mm-hmm.
It's kind of a question too.
Yep.
So correct me if you feel that I'm wrong. I posit that because we're so much better developed muscularly than, the kid at the pool,
mm-hmm.
I don't want the viewers or the listeners to think, well, my shoulder blades don't poke out 4 inches, so I don't have any type of impingement there. It's not going to be that dramatic with us because of the muscularity that we have. So using that visual may not.
Good job. I've had multiple bodybuilders, even guys who've won shows, right? Men's Physique, several masters guys, their shoulder blades are still doing that, even as muscled as they are. Right. It's more common, you would think, in that when I'm assessing shoulder blade or shoulder motion, you're looking at something called scapular humeral rhythm, which is how does the shoulder blade move in relation to the upper arm, right? And that's often a lot of people, even highly developed, right? Okay. So yeah, it's relatively common. So I'm with you. I would rather him lower the weight if he wants pure hypertrophy. Again, significantly better than I anticipated. His bracing is pretty damn good, right? I am a DNS bracing guy, bracing through the belly. Damn good. In his video, he's breathing incredibly heavy every rep at the right time. So I liked that. I would say, if it was me, I would say drop the ego a little bit. But you are doing the whole power building. Now, I personally am not a fan of power building, right? That blend, like do one or the other. I'd rather folks do dedicated blocks, or one thing I used to do when I worked with a lot of powerlifters in their off season was, their first exercise of the day would be the 1 to 3 rep range, and then they would go to hypertrophy. So you're getting the super heavy stuff to maintain that strength because it is a skill, and then you're doing the higher. So that's something that I think could benefit. But yeah, or he does this and then he does a back off. It's funny. I thought 90 to 95 pounds too, I think would be just perfection.
Yeah.
Where he would even be able to pause for a sec up top. But I like the one arm, right? Because remember we talked about when we did our episode on this, how your one arm, because you're getting a little bit more external rotation, because I forgot to mention in this position, if I internally rotate, impingement goes up, especially if you don't have that shoulder blade control. That's why I always talk about the chest press of watch your shoulder. When it rolls forward, you're off your pec, you're square on the bicep tendon and putting strain on the rotator cuff. So the one arm allows you to do that, but he is leaning over. But yeah, his traps and levator got to be so damn sore the next day.
Well, that's where I was going to go. I think that, and again, correct me if I'm wrong, you're the brains of the operation here. I'm
That's
going
dangerous.
based on feel. I know we're all screwed, right? No, but I'm going off of experience in the feel. And that is, in a movement like this, or in his specific situation with this specific set, the traps are moving at the very least the first 1/3, 1/5. That is almost entirely trap.
So
Getting the bar moving.
supinatus does the first 15 degrees, then the delt takes
Even on
over.
an upright row?
Yep.
I knew it did on a side lateral.
Yep.
Okay.
Yep.
Okay.
Yep. Because
Okay.
it's still shoulder abduction,
Good
which is
point.
arm out to the side.
It
Yep.
makes total sense. Now I
Yep.
feel dumb for saying it.
No,
And
but
honestly,
kudos to him. I'm going to turn to the side. His arm is starting in this. God, this blue shirt's not the best. His arm is starting more in this forward position than out to the side. Because if my upper arm's slightly forward 20 to 30 degrees in relation to straight 90 degrees, that's called scaption plane, where his upper arm and his shoulder blade are parallel. That allows the rotator cuff to better stabilize.
and I do like that he's leaning in,
Yep.
you know, versus standing directly
I
up.
would have recommended him to lean in to
Mhm.
help, give him that mechanical advantage to get it going. But there is a lot of momentum, but there's a lot of eccentric loading. But I go, oh, here's the counter. Here's the first one for this episode. That is job security for me. Because it's
Right.
not if, it's when the levator or the trap, but probably the levator gets a little pissy from him
Right.
doing that motion.
And
Yep.
anybody who wants to submit videos for, you know, form assessment, understand that we're not going to 100% throw you under the bus. I mean, I guess if it's really bad, we
Yeah.
might. But
Depends what you give us.
yeah, and there, you know, this is a good example where there's a lot of there's positive takeaways here,
Yep.
but then there's
Mhm.
some things like, yeah, I don't know about that. So
Yep.
you know, there's things to fix, and there are typically things that are still good, and there will be positive takeaways too. So I'm not going to say don't not, because a double negative is not in my. Nah, I can't do that.
Mhm.
Don't hold back and not submit a video because you think you're just going to get blasted. I mean, we're pretty fair. Now, if it deserves you getting blasted, you can count on us. You can trust with confidence. I'll rip you to shreds if it's crap. But it typically isn't going to be.
Yeah, I would have lost a bet if he was actually going to show us the video. So
I'll be honest. Same thing.
Respect to him. So kudos for both guys. But especially when he said one arm dumbbell, I was like, okay.
You know what time it is?
What time is it, Skip?
It's time for the prehab rehab rodeo roundup. Woohoo! I am never gonna not like that.
Yep.
If you said tomorrow,
Mhm.
bro, we can't do this anymore, I'm be like, well, that's
I've
too
run out of
bad.
ideas.
This segment isn't going anywhere.
Mhm. All
What
right,
do you got for us?
We've got one of my favorite ways to quickly unlock hips to help with low back. You need no equipment. I've definitely done this on a rest stop. I like doing it in the gym. However, I think most people do it incorrectly. So let me set the record straight. This is the marvelous way of how to do a 90-90 drill, right? So on screen is a clip from one of my seminars in the gym. So we're on the ground, 90-90. This is from FRC, Functional Range Conditioning. Why I like this is no equipment. And two, your front hip is externally rotated and your back hip is internally rotated. So you're getting access to both ranges of motion, right? So every joint in your body rotates, even your knees, even your elbows. If we unlock rotation, we unlock every direction of motion. So when it comes to quickly unlocking the hips, that is directly tied to low back pain plus workout performance and using your assets, pun intended, right? We want to unlock rotation so long as there's not an acute injury like a hip labral tear or, or you have a MCL tear in the knee, because that would be a hard position. So this is a big bang for your buck that I give to almost every single lifter. So you're going to be in this position, and a lot of people hang out there. They'll lean forward, they'll round their lower back. They just do gentle stretching. What do I always say? Passive stretches, passive modalities get passive results. Let's add an active component. So you got to sit up super tall, and then not letting your low back round. You might need to prop yourself up. You would use your leg muscles to press both shins straight down to the ground, 10 to 20% effort. So you'll feel your hips turn on. You hold that for 5 seconds and you relax. And you would do that for 5 rounds. So I typically recommend people do 2 to 3 sets of 5 rounds. One thing to point out, that back leg, you are stretching out the posterior hip capsule on the back leg that is internally rotated. If you are somebody who is super tight, we need to stretch that hip capsule out. Otherwise, you're never going to get the internal rotation we need. and it's going to be a little tight and uncomfortable. So as we unlock that, it'll get better. To a certain point, though, this is going to be too easy or not be a big enough stimulus. Or if you're somebody who has more mobility than me, which is that of a refrigerator, we're going to want to add some more. So you could emphasize the front hip by leaning your torso slightly forward, so long as your low back doesn't round, though, right? So for me, I'm upright. My first time leaning forward, I'm only going 2 or 3 inches. And then I'm going to press down again. And then what I like to do is I hold it for 5 seconds. And then while pressing down, I push myself back upright for just a little bit more glute activation stretch in that front hip. And then ideally you could go a little bit farther forward. If you want to emphasize the back hip, you just turn your shoulders to face it and press down. It'll be a little uncomfortable, right? So, but again, I like it because both hips are getting external and internal rotation. You will get a little bit more benefit of external rotation mobility gains from it, but you're stretching out the backside of the hip capsule, which is setting the stage for other internal rotation drills to do their job. But again, no equipment is needed. It's super sweet. The idea of the guy who created it is Dr. Andres Espina. I think I said his name wrong. He was actually a black belt in jiu-jitsu, and this is S-guard in jiu-jitsu. So people who roll be like, that's a 90-90, that's S-guard. So essentially he created this whole mobility system that is essentially specific for jiu-jitsu and martial arts. And a lot of it is open chain, meaning the limb that you're working on is not in contact with the ground. Now this is closed chain, but a lot of it's not, which is hard to replicate. But I like it. His idea is you take the joint to end range, right? Because this is going to be end range for most people. And then by activating, you gain not only access to further range of motion, but by going to the end range and activating, now your brain has better control to the full range of motion. So again, big bang for your buck. So 2 to 3 sets of 5 reps each side. Usually most people are restricted in internal rotation on the right hip. So when that right leg is the one behind you and the left leg's forward, that right hip's usually a little bit more uncomfortable. Not always, but I would say 85 to 90% of the time that's the case. So you're going to be a little imbalanced. Don't freak out. That's why we do both sides. Huge bang for your buck, whether it's for low back pain, low back stiffness, hip pain, hip stiffness, athletic performance. I guarantee if you give me 3 rounds of 5 reps with a 5-second hold on both sides before your next leg day, or if you're doing a hip hinge bent over row movement because you need your hips warmed up, if you don't notice a difference, come on here, blast me, because 1, it'll boost the algorithm, and 2, you could tell me how dumb I am, right? And I'm a charlatan and blah, blah, blah. That's how confident I am, but be consistent with it. The last thing I will say is making the changes harder than maintaining. So if you're super tight, you doing this once a week before leg day, it's going to help for leg day, but you're missing a lot on the table. If you could do this bare minimum once a day, even if you're not training, watch what happens with your hips. I bet your low back feels looser. Your hips get looser, easier in the gym. Your training gets better. Big bang for your buck. No equipment, no excuses.
Nice. That's right. Absolute. Q&A. I think we have a couple questions.
Mm-hmm. Okay. So we've got 2 questions. So let's do the short one. And then this, if we have time for the second question, it's from Spike. So this is the Spike show. It's kind of
exactly.
But hey, appreciate all the commenting.
Oh, yeah.
So let me pull this question up. Okay, so this is from K_Gregor. Question, I've been focusing on shoulders the last 7 weeks. I'm a stomach sleeper and both shoulders are falling asleep when I have them up under the pillow. So I'm assuming he's talking like arms overhead.
Yeah.
What stretching am I missing? Also, the right pec tendon is also very tight. Again, thinking it's more related to shoulder training. Dumbbell, lats, machine shoulder press, and an incline bench underhand grip dumbbell press, elbows bent through that movement. And then he said, go Badgers.
Ah, nice.
So
Marlins today, but Badgers next time.
What most likely is happening is
and there are a couple positions with the hands up. I sleep. My wife can't figure it out.
Mm-hmm.
I sleep on my forearms. Yeah.
Oh, kind of like that?
No. If you saw me sleep, I put the pillow, I have a couple pillows. So I put
Yeah.
the pillow up on my forehead so that I, air can get it because I'm a fan. By the way,
Yep.
any of the listeners, viewers, you need to comment because I'm going to make a point here that I think a lot of people get who sleep with fans. I need to hear from you if you sleep with a box fan. I should say I need to hear from you if you don't sleep with a box fan on,
Yep.
because that is you're my people. That's white trash. I don't care. I go out of town, Walmart is going to deliver me a $19 box fan. My wife is out of town this weekend. She goes, "Yeah, I couldn't sleep. I didn't have a fan."
Mhm. So
So
I
the
have
point is, I got to
found
get that
is
air in there. So I
Yep.
was up on my forearms, and
Okay.
I literally, it's almost like my shoulder blades are retracted the whole time I'm sleeping. So you're the only reason I bring it up is because you said like, oh, they're stretched out. They could be stretched out, but I'm down here.
Mhm. Okay.
I
Yeah, that's possible. Yep. For people who struggle without a box fan, I'm the same. You literally type in background fan noise on YouTube. There is a video that's a blue screen that is 11 hours straight of a box fan.
but
And
it doesn't
play
work. I've
that.
tried it.
Oh,
Other
really?
people
Oh,
have tried
okay.
it too. They're like,
Really? That's funny.
no.
All right. It works for me, but that's funny. Yeah. Yeah.
That
So
is
let's pull up the anatomy app again. And then there's two things I want to put on his radar. One of them I've talked about before, one I have not talked about.
and he said that this is only on one side, right?
So both sides, but his right pec is tighter.
Okay.
Yep. So this is what's most likely is happening is he's most likely getting, it's called your brachial plexus. So it's not the biggest thing, but if I zoom in, here are all the nerves that go down into your arm. So this is everything that eventually turns into your median, ulnar, and radial nerve, which goes down in your arms. But you've got a bunch of cords of nerves, and they go through this part of your neck called your scalenes, right? So there's, tight scalenes cause that. And then the other common side of compression is right here, your pec minor, right? And he's saying his right pec tendon is tighter. So it's super common when we're lying prone, head turned to one side, arms overhead, we're getting compression there, right? So it would be a biomechanical neurogenic, I guess, thoracic outlet syndrome. If you want a scary diagnosis, just compression at the neck. Going through these, when it comes to that, I would say look at your breathing pattern. A lot of people breathe. That was a rehab rodeo roundup. I think it was the third one ever where they breathe elevating their shoulders day to day. That should not. These muscles called your scalenes, there's a front, middle, and back. They should only help you breathe when you're working out. You're doing HIIT cardio, you did a Widowmaker set. Your shoulders should elevate only when you're dying for air. So one, look at your breathing pattern. And then two, there's a specific way to stretch pecs that I get better results with when people have entrapment there. I will say, though, it's super common for people's shoulder. It's a golf ball sitting on a tee for this joint to be shifted forward, right? So it's super common. That's going to add to compression to it. So just putting that in. But also, most people are right-hand dominant. Your dominant side is going to be tighter because we use it for everything we do. So if you want a fun experiment, put your dominant arm in a sling and be blown away by how much you'd use it for everything. We use our dominant arm for everything. So I'm always in this forward position, which will most likely bring it slightly forward and then add more muscle tone in the front of the body, compressing those areas. So there's that. Neck strength is going to be really important because those scalenes will try to kick in for your deep neck flexors. But what I would recommend for him, especially for the chest, of getting that to release. Let me go back to sharing my screen. Sorry. Let me just make sure everything's ready to go. Okay. Because I'm going to have to talk through this. Luckily, I refilmed this video last night. I have to refilm 600 rehab videos for my office. So luckily, this was one of them last night. So share screen. All right. So this is from that Doctorus Andres Espina. So I might have misspoke. The 9090 might be from FR. This might be from FRC. That's just business name acronym. So regardless, this is how I prefer to stretch. And when people have a tight pec, especially a pec minor that is causing issues, this is how we go to. So on the screen, this is how most people stretch their pec. Their elbow at 90 degrees. Let's be honest. Where do you feel the stretch? Do you feel the stretch in your pec or where your front delt is? It's your front delt. So you're stretching out the front of your shoulder capsule. You're getting a hell of a lot of front delt. You're not getting a lot of pec. So so that's I'm saying, right? That's where most people feel the pec stretch when they're doing it that way. And that's not what I want. So the easy fix is you reach your arm up like that and then you slightly turn. And I want that stretch to be where the pec is, especially the pec minor.
When you were setting that up at 90 degrees, I'm thinking to myself, why would the elbow not be higher?
Yep. So that when I ask patients, like, how do you stretch your chest? That's what most people do. So this is what we want to do. Now, this is an approach called PAILS and RAILS. PAILS stands for progressive angular isometric loading. RAILS stands for regressive angular isometric loading. Nobody's going to say that. That's why we call it PAILS and RAILS. I'm going to give you how I coach people how to do it because they have a specific protocol that while it is amazing, it's going to take 7 to 8 minutes per side. I don't got time for that. Their concept is you hold a sustained stretch. They want up to 5 minutes. I say, give me at least a minute. If you have time for 90 seconds to 120 seconds, even better. But give me at least a minute. So you do the sustained stretch that certain mechanisms in the muscle that we've talked about will relax to allow yourself to stretch further. So static stretching just gets structures that are normally protective to not feel like they need to guard you against tearing your muscle. Otherwise, every time you flicked your wrist, you would tear something off the bone, right? There's protective mechanisms. So if they're stretched for a period of time, let's just call it a minute to be safe, they will relax and you'll get further into a stretch. And then when you're done stretching on paper in a vacuum, you have access to this new range of motion that might be an extra 1 to 3 to maybe even 4 inches. Here's the issue though. You normally don't have access to that. So if you have this new range of motion you don't have access to and your brain doesn't know how to control it, that's when injuries could happen. So you do the sustained stretch for 1 to 2 minutes. Then what you're going to do is you want to add an active component of what I forced earlier. So you would alternate between, and I'm talking about ramping up, ramping down. So I think I could quit sharing my screen because we showed the stretch. So now you're going to alternate between pressing that arm into the wall to load the pec for 10 seconds, but you're not going to go 0 to 100. You're going to slowly ramp up, which is what I was showing on screen. You're going to hold that 10 to 20% effort for 5 to 10 seconds. I prefer 10. And then you're going to picture pulling back the opposite motion. Same thing, slowly ramping up, holding it for 5 to 10 seconds, and then go back to pressing. Ideally, this is relaxing, your brain's controlling it. So I'm getting a little bit further in the stretch. You do that alternating back and forth for 3 to 5 rounds. So at first you relax the muscle, so I have more range of motion. Now I control it. I'll even get further in that range of motion. It's awesome. So people will only want to stretch the pec primarily like this. This is better. Then adding the alternating back and forth works even better. And then, yes, the compression is happening here, but I never like treating only one side. This technical term is your axilla, your armpit, because you've got your pec and then you've got your teres in your lat. I want to treat both. So you would do this, but we still want this to release. And that's when you do the stick dowel thing that I've shown multiple times where you're mimicking pinning and stretching. So if somebody comes in with that, I'm going to pair those two things together.
Let me just add, arms up like you're doing. Pretend that you're on the ceiling of the gym looking down at me because I'm lying back on a bench and I have 2.5 or 5 pound plates in my hand. And I do that before back or chest. The other thing I would add is, and this is a question, where do pullovers play a part in helping this guy? It's not specifically a stretch, but it's a stretch exercise. So my question would be, is he doing pullovers? Is he not? If he's not, would doing pullovers, even not even necessarily heavy ones, be a benefit to opening up that shoulder, the pec minor, teres, all that kind of stuff? I think it's a
On
great
pa-
exercise. That's why I
on
wonder.
Yeah, on paper in a vacuum, yes, unless there's something else going on, because but again, that upward rotation of the shoulders where most people get limited. But yeah, you're getting sustained stretching on that pec similarly. So as long as it's, because he's only going to be in that position where he's getting the nerve compression temporarily. It's just because he's lying, sleeping this way for extended periods of time, right? You sit on the toilet long enough scrolling through social media, we all know what happens, right? Compression for an extended period of time causes it, but the pullover shouldn't cause it. We've got to figure out why his pec tendon's tighter on the right. But like I said, could just be because it's his dominant side. But I bet more often than not, when people have a compression, it's the neck and the shoulder joint itself is involved. But on paper in a vacuum, I think that would be super helpful. But then, and then just breathing pattern, and then you got to get the core of your neck stronger. But I think I gave him plenty of things to work on. And pails and rails, you could apply it to any joint in the body. So if you're not sure how to do it, just YouTube it. But if you're doing like knee flexion based, where you're bending your knee to stretch your quad out, you better slowly do the hamstring contraction. Otherwise, you're going to cramp like crazy. There's ones to do it. Always remember, I'll finish with this. You could do it for your hands and wrist extension. And the palm of my hand cramped the first time I was learning this approach. And if you've never had your palm cramp where it's looking like a claw hand and you're trying to open it up and I'm screaming. So that's when, I was training people out of my garage because I was doing the course to learn it. And she thinks, I really hurt myself. It's just a hand cramp. And I just was a little, because I've never experienced that before. She's like, you're so dumb. I'm like, well, that hurt. She's like, I thought you legitimately like hurt. Like we're calling an ambulance. Yeah. So, but yeah, pails and rails, you could apply it to anything. But that's how I do it, a little bit shorter. Yep.
Got time for the other question?
Yeah. Let's knock out spike since we've talked about it so many times. So real quickly, because I have my opinions on this with some research. What do you guys think about some trainers saying the peak contraction doesn't matter? Is it the stretch position that counts only?
Well, off the top of my head, it's certainly not only. I don't like absolutes. My kids will tell you, my wife will tell you, I abhor the word, at least in relationships and arguments, debates, if you will, ever, never, always, things like that. The stretch position, more fibers are firing in the stretch position. Arguably, the stretch position, it could be argued is more important than the contracted position. Is he asking, read it again, just so I'm very clear on.
Yeah. So he's saying some trainers say the peak contraction, i.e. the shortened position, doesn't matter. It's the stretch position that counts.
Okay.
Right? There's this huge shift of you only need to do lengthened position movements. You don't need to worry about the shortened or the contracted.
That's a good question, actually.
And I have very strong opinions, but
okay.
I've talked way too much.
I can say you could get away if you have to give up lengthened or contracted. I would always go with lengthened. That is
doing lengthened, not giving it up.
Doing. I would give up if I had to give up one. If I was forced, you got to give up one. I would give up the contracted position, but I don't want to give up either one. I would almost, arbitrary numbers to make my point, I would almost go with a 2/3 significance or maybe even 3/4 on the lengthened position versus 1/4 to 1/3 on the contracted position. Off the top of my head, I'm going to be honest, and then because I'm going to defer to you very quickly because I won't have anything else to add. I don't think the contracted position to me is more about the full range of motion than it is like, oh, I have to get this, like this squeeze at the top is going to create more growth. I don't buy that. I've never really subscribed to that. Press downs, you got to get that squeeze at the bottom, and the harder the contraction, the better. Well, I can squeeze harder on a 50-pound press down or feel it contract, like squeezing it much more than if the weight is doubled, yet I can move the doubled weight through a full range of motion. So what have you found? What do you have on paper or in your studies? What have you found as far as significance to the contracted position? I'm all ears. I'm curious what's there.
So if we want to sum it up, the shortened position of muscle during weightlifting does affect growth, but current evidence says that yes, training at a longer or a stretched position tends to create greater hypertrophy compared to training at shorter. But there's a caveat. Initially, it's initial growth and it actually increases muscle length and diameter, right? And it's typically further down in the muscle, right? We talked about, training the biceps, how that incline dumbbell, right, trains it further there. But how do I say this?
Yeah, it's hard to explain. It's
Stretch
kind of
mediated hypertrophy. This is the overcorrection, and everybody wants these black or white camps. It remains relative for muscle growth, but it's more relative to beginners because after the initial adaptations, right, how much stretch mediated hypertrophy matters doesn't. Like we have studies of the more advanced the lifter, lengthen doesn't matter anymore. Beginners, it does a ton. And its practical impact is most pronounced when conventional training is limited. So either in rehab, somebody's immobilized rather than well-trained athlete. So once you're trained, it doesn't seem like you're going to get as big of a bang for your buck. But early on, you're going to get more muscle protein synthesis, more mechanical tension, more fatigue from lengthened position movements. But once somebody's well trained, it doesn't seem to make that big of a difference.
Okay.
That's the best way I could sum it up. There's going to be a bunch of studies on the page. I'm trying to take a 10,000-foot view because if you look at stuff of beginners versus advanced, it doesn't matter as much. So it's just the overcorrection. When is an extreme ever the real answer? It never is.
I relate it to the argument of negative versus positive, or the negative portion of a rep versus the positive portion, eccentric, concentric. We can see that there's more growth potential in that negative part of the rep, but we're not going to train negatives. You're still going to use the positive. So my advice still it's unchanged. It's you still want the best range of motion. You want a good stretch, not forced. And you want when I say not forced, within your structural range of motion so that you don't increase the risk of injury. And you want as much of a full contraction as you can because you want to work the muscle through the entire range of motion. I'd argue the better the range of motion, the better potential you have for development.
Like we know I like the complication and the minutia. And I talk about, it doesn't matter for 90% of folks, but if it does, I always go shorten first because we know that once the muscle fatigues, and then fatigue is, that's a complicated subject, but your ability to get a muscle fully shortened wanes as the muscle's fatigued, and lengthened position movements dramatically increase fatigue because it's messing with calcium ions, and certain people overemphasize that, but to each their own, right? So I go shorten first. Then I like to go lengthen, right? Because I already got the muscle warm too. I don't like going lengthened on a cold muscle, right? I think John Meadows had it right. Or, he did stretch and squeeze after the muscle was full of blood, right? So I typically go shorten first, then lengthened, because it's full of blood, so lengthen's hard. And then I go mid-range last because you're going to be strongest in the mid-range because how much your muscle fibers are cross-bridging and cross-linking, you have the greatest potential for force output in the mid-range position. So you're going to be slightly stronger in a mid-range position than a lengthen. But again, sometimes I flip-flop it, but I would say 80% of my training programs I write for people shorten to lengthen to mid-range. But it's not for everybody. Most people don't need to worry about that. But I like playing with it, but I am not a fan of lengthened positions first when it's cold. Also, you got to get the tendons warm. Like tendons take a lot longer to warm up. And then tendon cells are really reactive to stretch loading for only about 10 minutes. So you want to get those suckers warmed up before you start going in these vulnerable positions. And again, though, like train all rep ranges, train all muscle lengths. Like, good God, like quit being so dogmatic.
Right.
Like, Yeah.
Could not agree more. That is a really good way to sum it up.
There we go. Yep. Awesome.
On that note, I'm gonna take us out. You gotta get to getting. Skip and Dr. Marv splitting. If you enjoyed the show, be sure to like, subscribe, share, and ring the bell. If you didn't like the show, pretend you did. Like, subscribe, and share, and ring the bell. And we have this new thing, hype, the hype button. Make sure you hit the hype button. But without the hype button, it would sound a little something like this. Be sure to use the TrueNutrition.com link in the closing credits to save 10% on not just Team Skip Protein, but every supplement they sell. Dr. Marv, how can someone reach out to you? If you have questions or they want to work with you?
Easiest way is Instagram at dr.marvin.saysdc. My office is Coastal Performance Chiropractic in the Houston Bay Area. The website is getting updated, so the website is down, but you could still book online. And then theeducatedmeathead.com, that will be getting updated next. That's for consults, workout programs, blah, blah, blah. And then we'll leave it at that for now.
If you have too much skin, I'm your guy. I take fat people and I turn them into not fat people. I don't know. That was just off the top of my head.
Yeah,
go to teamskip.com and you'll find all my contact information, including Team Skip merch. You can also follow me on Instagram at Intense Muscle. Keep in mind, this is a team of 3. I'm just destroying this, not 2. Chris is the enigma behind the scenes, and he's responsible for the visuals and graphics, and he also plays a huge role in the creative process. This project would not work without him. So from all 3 of us, it's been a business doing pleasure with you. Join us again next week for another issue of, or episode of, I'm just going to wreck it, Between Two Dumbbells. Just
lots of bloopers today.
Oh, man.
Lots of bloopers today.
Oh.
You're just giving Chris info.
I just keep going. I'm like, I'm married to this. I'm going to go.